So in details, when you look at this dimorphic disease called histoplasmosis, is an intracellular mycotic infection where the fungi is able to inspect what we call the endothelial system. Normally, originally it starts by inhalation of the conidia from a fungi uh, called Histoplasma capsulatum. These are worldwide disease, distributed globally, but study shows that it is majorly domiciled in USA at a place called Mississippi River Valley, though other regions have shown to be having the disease. This has been then also have in Australia, parts of East Asia, so fungi Histoplasma can be isolated from the environment, and normally it's associated with the contamination of the soil enriched with excreta from chicken, starlings, and birds. So those are the main server or sources of this fungi, Histoplasma capsulatum. Studies have shown that there are two major variants of this Histoplasma capsulatum, which are recognized to be causing disease in human, and that is Histoplasma variant capsulatum, which is a common cause of this histoplasmosis, and we also have Histoplasma variant causing histoplasmosis. Though in terms of morphological appearance, these two variants, are identical. Saprophytic molds that, but only differ in their parasitic tissue morphology. Parasitic more of the yeast appearance, but for the molds first, they are so common, they are so identical that if that is the only identification method, you will not be able to differentiate them. In terms of clinical presentation, ideally 95% of cases that could be to have contracted this disease, they're inapparent. Inapparent simply no, it means that they don't show clinical, they don't have clinical presentation, no clinical symptoms, um, or it could be very benign, since you may not realize that this could be the histoplasmosis infection. However, the 5% of the cases that could proceed or progress to lung disease, this lung disease can be very chronic, which thereafter through the cutaneous can also spread. It has the capability of spreading to other parts of the body, other organs, you know, causing what you call acute fulminating fatal systemic disease. It can now, from the lungs, can spread and infect any other part of the body so easily, and becoming very, 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 you know, dangerous. And at that level, I mean, most of these stages, this disease can present like tuberculosis, persistent coughing, wasting away and all that. So how do we capsulatum? What skin affected with, presented for in the lab for identification. Sorry, you can also do what we call bronchial washings before coughing, or you can also do CSF, cerebral spinal fluid, little cavity, blood, urine. All these samples can be used with a view of trying to identify this Histoplasma capsulatum. But